In the University Hospital in Marburg, Germany, intensive research has been taking place regarding glaucoma. With me today is Professor Ilse Strempel. Welcome. Which patients risk glaucoma?
When you ask me regarding the risk factors, age is of course, naturally one. Genetics are the next. So when you have someone in your family with glaucoma, a father, mother, uncle, aunt, sister, brother, etc., there is an increased risk for you also to develop glaucoma. In those cases you should be more alert than in other cases. Also, patients who have a high degrees of myopia must be extra careful.
I heard the ethnic background can also play an important role. Is the number of glaucoma patients worldwide equally spread, or do you see differences?
Yes, worldwide there are big differences. In the Caribbean, glaucoma is more present. And in Africa the amount of glaucoma patients is 5 to 6 times larger. And glaucoma also start 10 years earlier in life. It is more complicated regarding its treatment.
What are the causes?
How can we classify the different forms of glaucoma? The causes are multifactorial. Many components play a role. Main issue is the intraocular pressure. This pressure reaches the nerve path, which can result in damage to the optic nerve. This is the main group. There are, however, different groups. In my opinion, it is important that the patient knows to which group their glaucoma belongs, because every different form of glaucoma requires a different treatment. Main problem is the intraocular pressure. It is also possible glaucoma is present without an increase of the eye pressure. Unfortunately, glaucoma does not give signals before. For this reason one should be very careful. So there are people with normal eye pressure glaucoma. These group of people can become blind without it is being noticed. Only when vision loss is experienced this patient will take action. Yes, again the problem is noticed very late in the case of glaucoma.
When should the pressure of the eyes be measured?
In general, after becoming 40, it is recommended to regularly check the eye pressure. Whenever there are signals, measure then sooner.
What can medicines do?
Medicines only decrease the inner pressure of the eye. Via that route protection is provided. All other factors like improved blood flow, optic nerve protection which we want to achieve also are minimal. All the things we want to achieve by our therapy, eye drops have a minimal effect on.
Mrs. Strempel using relaxation to prevent glaucoma. Why?
Yes, we know stress is a very important component in the case of an increased pressure in the eye. Stress starts in the brain or head and causes a cascade of reactions, by which even the last cells of the body will be informed that there is stress. And concerning the eyes, there is also a reaction. For example, muscles will contract resulting in a blockage of the fluids in the aqueous humor, causing an increased intraocular pressure. Furthermore, the stress will result in decreased blood flow, because the stress hormone adrenaline constricts the tissues, which also has an impact on the optic nerve. And this will result in even more symptoms. Our goal was to change the glaucoma process by taking away the factor stress.
Your statement is that the anti-stress therapy gives better results than medicines, while also other components of the glaucoma process have benefits.
Exactly. Our scientific research concludes, and we have done a lot of research, a significant decrease of the eye pressure. So a very important goal. Furthermore, we achieved also a significant improvement regarding the blood flow, something other therapies also did not achieve. By this we achieved a protection of the optic nerve. Besides this, because of the psychological counseling, we also improved the psychological well-being of our patients.
A question from Jordan. Can nutrition and temperature or sports decrease the eye pressure?
Nutrition does not change the ocular pressure of the eye. But it is wise to give attention to the benefits of nutrition and vitamins, because in case of glaucoma there are many mechanisms which have a connection with nutrition, like inflammation or its influence on the immune system by increasing the amount of free radicals in the eyes. We can influence these harmful components. The pressure itself does not change. Sufficient sleep, exercises.
We talked about the option medicines, but have not yet discussed the option of an operation. When do you make the choice to do an operation?
When all the other options failed or when there is an allergy. In that case an operation is the last option. So when the desired pressure is not achieved.
Is there new sensational news from science regarding this subject?
No, in general we are still doing what we did 40 years ago. The near one or best thing to do is to lower the eye pressure.
The pressure must become lower. That is what it is all about. Thank you very much, Mrs. Strempel.